So we are, I know we are at the very beginning of the event, and I feel it's going to be very interesting. Don't you feel that? It's going to be very interesting. So to kick things off, please join me in welcoming Dr. Peter Voisin to the stage. Dr. Voisin is Infoway's board chair, former Deputy Minister of Health and Wellness for Nova Scotia. He is a member of the Order of Canada and former Canadian Forces Colonel Commandant. Dr. Voisin will introduce our first keynote. Thank you, Peter.
Bonjour tout le monde. It's a pleasure to be here and welcome to Ottawa. It's great to see so many dedicated leaders and innovators and partners gathered here as we continue our shared mission to advance connected care in Canada. As chair of Canada Health Infoway Board of Directors, I've had the privilege of witnessing firsthand the tremendous strides we've been making in connecting Canadians and in digital health innovation. Progress that is only possible through the collaboration, the shared vision, and a commitment to building a more equitable, efficient healthcare system. Our work together is more than simply modernizing healthcare. It's about creating systems that serve patients better, empower clinicians, and help our communities thrive. Today, it's my distinct honor to introduce our opening keynote speaker, Joe Voisin, who's Assistant Deputy Minister with Health Canada. Now, Joe brings a wealth of experience to overseeing Health Canada's collaboration and their efforts to strengthen interoperability, remove barriers, and champion connected care across our provinces and territories. Her insights offer us a critical look into the steps Canada is taking to create a seamless healthcare experience for all Canadians and the power of digital health and what that plays in transforming our health systems. So please join me this morning in welcoming Joe Voisin.
Well, I thought for a minute there I was going to be off the hook, but... So thanks everyone for having me, and it's really an honor to be here, and happy Digital Health Week. It's so great to see so many people in the room, and such a different collection of people, including vendors, patient partners, government partners who I recognize. So it's really an honor to be here, and thanks to you, Grandma Karen, for your very thoughtful opening. I think part of the theme here is progress, as Michael said, and there has been a lot of progress over the past year and over the past few years. So I'm going to talk to you this morning a little bit about the progress we're making from an FPT perspective, so federal, provincial, territorial governments in terms of advancing digital health. Alors, je comprends qu'il y a la traduction simultanée en français pour les francophones. Alors, je vais faire mes remarques en anglais, mais si vous avez des questions à la fin, vous pouvez sans doute les poser en français aussi. So, as noted, I am the Assistant Deputy Minister for the Health Policy Branch at Health Canada. I've been in that role for some time now, a few years. And have been leading on this file, and I have the privilege of really understanding how health data fits into all the other health priorities that we're working on from a pan-Canadian perspective, as well as health workforce, primary care, and how all those things are integrated. But this is really one of the top priorities for the federal government, and you will have the privilege, I think, today to get a lot of Health Canada time. So my minister is coming to speak to you. My deputy minister is also going to be in a fireside chat. And of course, Elizabeth Toller on my team is speaking in a panel as well. And this work that we're doing is really a partnership. Like it is not just a federal government initiative. We can't advance this without the people in this room and many others. So thank you very much for that. So I think, yes, all right. So in terms of when we talk about connected care, and I think, speaking to the converted, I think everyone here kind of understands what connected care is. And as much as our hosts, said interoperability was a wonderful word, I would agree, but I think it's also a word that is difficult for some people to get their heads around and really understand what we mean by that and how important it is. So it's really about allowing information to flow across the health system. So that health data, so that patient has an access to their health data, that healthcare workers and healthcare professionals can see the important health data about a patient. They don't have to repeat that story every time they go to another provider. So that will empower clinicians, but it's really also for secondary uses. So when that data is de-identified, it can be used for public good. So we can leverage that to draw insights, to inform healthcare system policy issues, and understand how the healthcare system is working, and also really, inform innovation. It's foundational to artificial intelligence and research. So really advancing new breakthroughs in health. So unfortunately in Canada, we're still behind other OECD countries when it comes to enabling access to health information. So only 39% of Canadians have actually accessed some of their health information online. So perhaps you can think of like test results from a lab, for instance, a private lab. But a lot of Canadians don't have access to that integrated patient record that would give them a sense of their lab results as well as their primary care record, for instance. And only 29% of physicians exchange records externally with other providers. Although 95% of Canadian physicians use an EMR, so as Michael talked about, a lot of these EMRs are not connected in an integrated way, that they would send digital information to one another. So sending a PDF file of a lab result is not digital health. And so we really want to make sure that that's integrated in a way that makes it seamless. This is especially true in primary care. So we've made great progress in terms of hospitals connected, but in terms of primary care, because those are operated independently, a lot of those electronic medical records are isolated and fragmented. And so many other countries have worked to bring in common standards, even using legislation to mandate standards and prevent data blocking practices, and we're moving in that same direction in Canada. So I think, as we know, the pandemic put a spotlight on the importance of health data and digital health, and spurred a lot of collaboration. An expert advisory group was developed and was called together and developed 3 reports on what Canada should do to fix the issue. And that work really has guided a lot of the work that federal, provincial, and territorial governments have done together. So one of the key first steps was a shared pan-Canadian health interoperability roadmap, led, of course, by Canada Health Infoway, in partnership with the Canadian Institute for Health Information. And that is really being implemented collaboratively with provinces and territories and vendors. So it's a 5-year plan focused on defining the common interoperability standards that will allow health data systems to talk to each other. And so the initial building blocks include preventing data blocking, enabling patient access to their own records, improving provider access to patient data at the point of care through a common patient summary, and improve care coordination and collaboration through e-referral and e-consult services. And COVID also put a spotlight on the need to better integrate health system data and public health data. So there was certainly a gap in terms of understanding sort of how the vaccination level of the population interfaced with people with COVID in hospitals, for instance. So how do we make sure that that data is integrated? So this all ties into the federal government's investment in healthcare in partnership with the provinces. So budget 2023 committed close to $200 billion over 10 years. in healthcare funding for the Working Together to Improve Healthcare in Canada plan, and it really emphasized health data as one of the key priorities that can be used for investment in healthcare. And those agreements have all been signed with provinces and territories, and they are rolling out action plans using this funding and their own funding. Many are making significant investments in health data across the country. Now, as part of this plan, provincial and territorial governments agreed to make progress on 5 health data commitments in order to access that federal funding. So one was collecting and sharing health quality data and reporting to Canadians on improvements being made. And we have really good progress on that front. The Canadian Institute for Health Information just published their latest baseline report with 12 common indicators that are really measuring progress on how we're improving the healthcare system together. The second area was adopting common standards to better connect the healthcare system, and this is really being driven through the interoperability roadmap. Next is aligning policy and legislative frameworks across provincial and territorial governments to support effective data sharing for the public good. And a key priority here is shifting the culture from one of a data custodian to stewardship. And I'll talk about that in a moment. And then aligning to person-centered principles, so a health data charter. And this is a quintessential piece that came out of this expert advisory group. And it really highlights a commitment to respecting Indigenous data sovereignty, providing equity and engagement and public trust, and core principles to really underpin the work that we're doing as provinces and territories in the federal government. And lastly, it was agreed to improve how health data about public health is shared between provincial and territorial governments and the federal government. So these are the building blocks that are really shaping our collaboration together. So over the last year, there's been a lot of positive progress made on this front. So as I said, the bilateral agreements are in place with all the provinces and territories for the targeted funding. The ministers, health ministers, federal, provincial, and territorial, have also agreed to a joint action plan that operationalizes those 5 data priorities and endorsed the Pan-Canadian Health Data Charter. And last June, the Minister of Health tabled in Parliament Bill C-72, the Connected Care for Canadians Act, which really aims to enable interoperability. So it underlies that commitment in the roadmap and would mandate vendors to adopt the interoperability standards and prevent data blocking practices. And I talked about CIHI's release of the Taking the Pulse report, which provides baseline data on the indicators. So to harness this momentum, a series of priority actions are planned over the next few years. So let me just get into those individually. So first, on interoperability. So Infoway with CIHI are really working on advancing the roadmap. So really this is about establishing pan-Canadian specifications required to support connectivity across digital systems. So some of the initiatives Michael talked about a little bit. So first there's the International Patient Summary, and that's really making sure that Canada is aligning internationally on what are the key common elements in a patient record. There's the Pan-Canadian Health Data Content Framework, which is really the standardized data elements across that patient summary so that those summaries can talk to each other. E-referral and e-consult specifications to further support the ability of physicians' IT systems to send and receive data in a consistent format for referrals and consultations with specialists. FHIR, as you know, is the common standard for exchanging data between systems and a common reference architecture for vendors to use system design. And to further support the implementation of the roadmap, mobilization initiatives are also underway, including the development of identity, access, and consent management standards, which is very important as we think about implementing this across the country, vendor compliance and conformance program, Pan-Canadian Health Application Lightweight Protocol, so HALO, and I will let technical experts explain what that is. and targeted investments to support physicians and vendors aligning standards and modernizing. So things like the Infoway Innovation Grant. So we hope to see continued adoption of the patient summary as a priority over the next year, and we'll move ahead on the use of pan-Canadian standards, including e-referral and e-consult. So just to talk quickly about Bill C-72, so the Connected Care for Canadians Act, it's a lot of C's and A's. So it was introduced on June 6th. So if passed, I talked about it requiring the adoption of common technical content standards and prohibiting data blocking. And so just to talk about data blocking for a moment, so this is really when access to health information is hindered, even when privacy laws or patient consent would allow it. So sometimes it's unintentional, sometimes it's deliberate. So for example, if there's hefty charges for access to health data, if a physician wants to change a system, for instance, or if a patient wants access to their health data. So the federal framework would act as a backstop when there's an absence of a similar law in a province or territory. And I want to emphasize that this legislation would enable but not compel the secure access, use, and exchange of health information across health IT systems. So it's really about helping to make it happen. And the existing provincial, federal, territorial privacy laws, including those that respect personal health information, would continue to govern the collection and disclosure of personal information. So this is really just about supporting the exchange of that health information. It would only come into force following the development of regulations, which would entail extensive consultation with stakeholders, including vendors, as well as provinces and territories and Indigenous peoples. And the regulation for standards would specify the interoperability requirements that vendors must adopt, guided by the interoperability roadmap and aligning with international standards. And so this is actually supportive for vendors, and it would help facilitate innovation and reduce the burden, because vendors would only need to comply with one standard across Canada. And many of our vendors, as we know, operate both in Canada and internationally. The regulations would also outline prohibited data blocking practices and define acceptable exceptions. So the US approach, for instance, allows for exemptions such as the unavailability during IT maintenance. And so there's other examples where there are exceptions. And they would be designed to allow for timely updates as the standards evolve. So that's sort of the technical side, but we know that in terms of improving connected care, it's really about people. And we have clearly heard that it's about how and when data is collected and shared, which is really important. So we need a culture shift away from custodians who are holding patient data towards being true stewards of this data, with patients that are still remaining the focus. So this is why health data stewardship is a key priority for the action plan. So as our working group chair said, it's really, we need to learn how to do health data. And so make sure that there's consistent approaches and collaboration across Canada on how data is collected for the benefit of patients, shared with trusted partners as needed, and de-identified elements can be used many times for public good. So while stewardship is not a new concept, there's currently no body in Canada that takes ownership to guide a common pan-Canadian approach to data stewardship. So given this is Canada, our working group thought it appropriate to use a Canadian analogy. So you'll see here, to get the concept, on the left is the National Hockey League, the NHL, and here we're comparing that to our federal, provincial, territorial, Indigenous tables, the Conference of Deputy Ministers of Health, the health ministers. So that's sort of the league, who are the decision-making or governance layer that's responsible for defining and setting the direction on the overall health priorities. And on the right is the operational layer. So that's represented by the hockey players, So these are the individual jurisdictions, the local data custodians, or stewards, hopefully, that are working on their own and making their decisions and interpreting the rules of the NHL to put forth by the governance layer. So we have been missing this middle piece. So the coach, or some people would say the referee, that would really facilitate the cross-jurisdictional collaboration and will steer a more coordinated approach to data stewardship across Canada. So this concept was initially developed by a federal, provincial, territorial working group with experts, co-led by the federal government and Ontario. So thanks to Christine, if she's in the room. This was recently endorsed by Deputy Ministers of Health, who tasked the Canadian Institute for Health Information to take the next step in consulting on developing the stewardship framework to bring forward to them for approval next fall. So recognizing the rapid advancements of artificial intelligence and how it can enhance healthcare delivery, our governments have also committed through our joint action plan on digital health to explore ways to support the responsible and ethical adoption and use of AI across health settings. Obviously, health data is foundational to the use of AI. You can't have AI without access to data, and you need to make sure that that data is quality data, or the AI will actually be flawed. So we're seeing strong benefits for the use of AI, especially in primary care. So you might have seen some coverage about AI Scribe and how that really can reduce the burden for primary care physicians and other physicians. So we want to see the acceleration of AI in health while making sure that there's safeguards against the risks. So we brought together experts in provinces and territories to develop some guiding principles for the ethical and responsible use of artificial intelligence. They outline shared values intended to guide the efforts in this space. They recognize the importance of existing pan-Canadian collaboration to improve the quality and timeliness of health data, so all the work we're doing here. And they highlight other risks to be managed, such as issues of transparency, explainability, the importance of shared accountability, appropriate oversight of safety, and real-world effectiveness. And they also recognize the risks of not deploying the transformative potential of AI, because there is a risk if we don't move forward to think about how we can do this responsibly and quickly. The development of the principles was informed by the advice of an external expert advisory committee, along with the input of these organizations, and that'll be brought forward to health ministers at their next meeting. So the next step is continued engagement on these principles to identify recommendations on what further actions we can take to implement this. And next, I want to talk a little bit about public trust, because I think public trust really undermines all our efforts to modernize the system. If we don't have the trust of Canadians and people who are interacting with the healthcare system, that the health data sharing and access to the data from their providers and their own access to data can help them, then we're not going to make progress. They need to understand how it's being collected, used, and shared to improve their healthcare and research and policy planning. So recent public opinion research showed that a majority of Canadians were not even familiar with the term health data and really didn't feel prepared to have conversations about how it was being used. And sometimes we also hear that they assume that health data is being shared, but they don't actually understand what the barriers are to that sharing. Or maybe they're surprised when they go into the health system and they find that it hasn't been shared and they have to repeat their story. And there are, of course, Canadians that are concerned about governments having access to personal health information. And so we need to really make sure that we bring along Canadians in terms of understanding how health data is being used. Experts have called for meaningful engagement and transparent communications to build trust, support digital health literacy, so what we're calling literacy is really understanding how that data is collected, shared, and used, and how we're advancing a coordinated strategy with our PT partners to advance a suite of activities. So we're developing toolkits for provinces and territories to use for public engagement, capacity building resources for health information professionals and also for health providers. And we're facilitating a series of roundtable discussions with different populations, including marginalized and at-risk populations, to better understand their specific issues and needs. So that will be rolling out over the next year as well. So at the core of this strategy for a modernized, connected health data system is really the imperative to enhance patient safety and to make healthcare better. It's a foundational piece. So getting the right health information to the right people in a timely way is crucial. So it's a long-standing problem in Canada, but I have to say that I don't think there has ever been as much momentum and progress on this file as there is now, with the legislation in place, with the collaboration we have in place with federal, provincial, territorial partners and all of the people in this room. And I think it's really time to harness this momentum. We have it now, so let's really move forward and make progress. And I kind of hearken back to the opening remarks from Grandma Karen, just feeling how important it is to Canadians. It's not just about data, it's really about making healthcare better for patients. So thank you so much for your time today, and I'm happy to answer any questions. So I'm not sure now what I do, but I stay up here in case there's questions, I think. Don't. Oh.
Morning. Thank you so much for sharing all the work that the FPTs have been doing on interoperability in digital health. I just wanted to ask a question. You spoke a lot about the data standards that surround interoperability and the things that are being done through the Pan-Canadian roadmap. What are some of the factors in terms of readiness, in terms of the readiness of the digital infrastructure in these healthcare facilities to support this interoperability? And are there any things that you're doing to look into infrastructure standards that will help healthcare facilities from large to small healthcare facilities be able to share this data? Because it's one thing to have the framework of how to share the data, it's another thing to have the capacity. So if you could speak a little more into that. Thank you.
Yeah, thanks for the question. I think, the capacity of the system, I think not only from a physical infrastructure perspective, but from, a human and health workforce perspective is really important. So as I said at the beginning, I think the Pan-Canadian Interoperability Roadmap and even the Health Data Agenda is really one part of a broader agenda to support the healthcare system. And so that includes sort of, federal investments in healthcare, which supports provinces and territories in terms of health funding through the Canada Health Transfer, as well as targeted money that's focused on health workforce, primary care, mental health, and modernizing health data. So there's sort of a range of investments the federal government's making. And then, of course, provinces and territories are actually making a lot of their own investments as well, and focusing on modernizing their infrastructure and health system. So I would say that this is just kind of like one agenda in a really broader agenda that governments are advancing. Hi.
Great talk, Simon Higgins from Infoway. Thanks very much for joining us. You talked a bit about the power of health data to unleash innovation, and I wonder if you wanted to share a little bit about what other departments in the federal government might be doing in this space and how you might relate with them. So obviously, it's a big topic of driving innovation.
So the government obviously has a huge innovation agenda. For instance, a lot of funding, I don't have the number off the top of my head, a lot of funding announced for artificial intelligence strategy, for instance, being led out of our innovation science and economic development department. I hope I got the acronym right. And of course, different initiatives like the Strategic Innovation Fund, which really supports more the private sector and industry. And I think we're seeing some really great partnerships coming out of those initiatives, which include private companies working with hospital coalitions, for instance, to advance AI solutions in health. And I think we would really encourage that kind of partnership. Like, I think those coalitions really can support both innovation in the country, but also really advancing those public good and health priorities.
Still have time for more questions.
Good morning, Colleen Rogers with Canada Health Infoway. I was really interested in the slide you had up on digital literacy for both patients and providers in AI, and the need in that area. And it's something that I've heard as well in some of my conversations with the various partners in digital health. I'm curious if you could explore a little bit further what some of the actions are, the planned actions are around addressing that need.
Yeah, so I think we're just getting into it in that, first we need to go out and really talk to people and understand all those different perspectives, because there are many different perspectives about it. I think there's a lot of people in this room who are, already converted and really understand the importance. And then there's, some people who are just not convinced, or who, have a certain reticence to think about how that health data is being used. And we really need to understand what their perspectives are, and then how that would influence things like, what would consent frameworks look like then if we were to, make sure that those people are comfortable as well. So we're engaging on some, roundtables, as I said, to get those different perspectives across the country, and then also to develop some common materials, which really just simply lay out sort of how is data, how is health data helpful to you? How is it collected and shared and used? So part of that is really developing the materials based on what we hear in those roundtables, so that we can roll that out. And we hope to do that in partnership with the provincial and territorial governments, and then hopefully other partners as well. That some of those partners are in this room, I'm sure. All right, I'm not seeing any other people standing up. So. Oh, one more.
Bonjour, je vais poser ma question en français, mais
oui.
on peut évidemment se comprendre en anglais, toute l'équipe. Donc, je suis Myriam Brel du Québec. En fait, je m'interroge beaucoup sur la diapositive qu'on a en face de nous mentionne les individus des Canadiens qui ont les outils nécessaires pour accéder à leurs données médicales. Présentement, on a des patients qui sont très impatients, qui savent que leurs données existent quelque part. On a aussi des partenaires qui sont capables de leur procurer l'information. On a des standards qui supportent la capacité de ces partenaires pour procurer l'information à travers des portails, des solutions de patients. Donc, qu'est-ce qui nous empêche? What is preventing us to provide those tools to Canadians?
Yeah, so I agree. There's lots of the solutions seem to be in place. So I think what is preventing us so far, and I think we're making progress, but what I think those underlying preventative things are essentially the fact that it's not common or consistent. So if you can imagine that if the fact that we have this fragmented healthcare system in terms of health data, at least, is partly because we have a range of primary care providers across the country who are operating independently, pick a different solution, and then those solutions don't talk to each other. So we're at a stage now where I think we can make progress, because we can leapfrog some of the issues that were a barrier before. And the interoperability roadmap really helps us get to a place where there's common standards for the exchange of information, so that we can overlay these innovations that can just pull that information out of those records.
Yeah. So all the ingredients are already there, and the standards are there. So I think it's time for us to make it happen. We were able to make that happen during the pandemic with some kind of a let's say, a national solution to be able to access, for instance, the vaccination status. So I think we are probably in a good position to be able to do that right now.
Yeah, absolutely. I agree. I think we are in a good position, and it kind of goes to the fact that there's never been that much momentum, and I think the pandemic helped with that. If there's one sort of shining light out of the pandemic, so I think really kind of keeping that momentum to get this done is really important.
We still have
Good morning. One more question.
Oh.
Okay. Pam Nolan, I'm from First Nations Digital Health Ontario. And I'm wondering, when you talked about data blocking and those sorts of things, what's being done with the legislation? So for example, the Privacy Act and in Ontario, PHIPA, blocks the sharing of information between federally employed nurses and provincial services.
Okay, so you're saying that there's federal legislation that blocks information share between the federal government and the provincial government in Ontario?
Yes.
Yeah.
For First Nations that receive services from federally employed nurses, there isn't that sharing of information that can flow freely between those two parties because the legislation blocks that.
Okay, well, we'll look into that because that's obviously an issue. The C-72 is really about technical standards, so it's not about whether information is blocked or not between provincial and territorial governments and that privacy legislation. So the data blocking provisions in that are really targeted to vendors and not necessarily governments. But we'll definitely look into...
Yes. Oh, no, I understand that.
Yeah.
I was just saying, so something similar to that. So information is being blocked in this instance. And I think that's a real issue for First Nations across Ontario when these sorts of pieces of legislation are blocking that sharing of information. So there isn't that ability to freely share that information. So there's we're digging into it at First Nations Digital Health Ontario, but we're coming up to a lot of roadblocks. So it would be good to have your help or get that on the roadmap here for the federal roadmap.
Yeah, absolutely. So yeah, maybe we can connect after and we can make sure that I can connect you with our federal counterparts so we can dig into it together.
Perfect. Thank you.
Okay.
there's one more. So we are going to get one more, and then after that we will take the break, 10 minutes. Thank you.
Good morning. Thanks for the opportunity to stand up. With regard to Bill 72, what's your anticipation from a timeline of moving that forward to be enshrined into law? And the second part of my question is with regard to the additional funding for interoperability, what oversight mechanisms are in place to ensure that money is actually used for interoperability?
So in terms of C-72, so as I said, it's been introduced in the House. So essentially then it needs to go through that parliamentary process in terms of being adopted as a bill. I don't have a timeline for you. That process is really governed by the government and Parliament. And then on the second question, in terms of the interoperability roadmap, I mean, Infoway is working really closely with provinces and territories on the implementation plan. And in terms of accountability for the funding that the federal government is providing to provinces and territories, all the bilateral agreements have action plans which are available online with targets for those. There's 3-year agreements for the 10-year funding, so the first instance of those bilateral agreements. So those action plans are online with targets over 3 years. As well as the common indicators I talked about that provinces and territories are feeding into with the Canadian Institute for Health Information. So we have a common set of data so we can kind of see how progress is being made on those elements, and those indicators include some indicators on health data and connectivity.